Now we'll move to DHA. It's an agency that didn't exist last year. It was formerly the Military Health System. This agency oversees an expanse of 56 hospitals and over 360 clinics, serving almost 10 million beneficiaries. It operates worldwide and employs over 150,000 civilian and military personnel. The total request this fiscal year for the DoD Unified Medical Budget that supports DHA was $49.4 billion, up slightly from last year's request. The IT budget also saw a slight uptick due to, in part, to revisions on how the department will procure an electronic health record, which we'll get to shortly. On the BRM front, healthcare delivery services is the dominant category, no surprise there. That's where the major health record information systems lie.
So for a little more background on DHA, in 2006, Congress recommended collapsing the service's Surgeons General and the various health organizations into one unified health command. Now, the problems with this plan are both operational and cultural. The Navy's trained to deliver care to units afloat and to deployed Marines. The Air Force has expertise in aerial platforms, and Army docs are trained to deliver medical ground support in combat theaters. And additionally, Army just wants to do things the way Army does things. Navy just wants to do things the way Navy does it. But despite cultural differences across the service branches, DoD really wanted a new governance structure for the military health enterprise that would help to slow down the growth of cost. So DHA was created to reduce redundancies across the separate medical commands by combining, where possible, the functions for purchasing, logistics, and IT. Now, creating a DHA also allows DoD to improve its ability to expand shared services to create common businesses and clinical practices. DHA's future operating model will consolidate all IT health operations, so that includes IT management, infrastructure, and applications. DHA plans to save over $600 million over the next 6 years, and to do that, they're planning for 3 years of targeted investment in hardware, software, and infrastructure consolidation, as well as application rationalization.
So you can see the services in the end retain their medical commands, again, to better suit their unique requirements. DHA is focused on the primary mission of medical readiness and will be responsive to the combatant commanders through a formal oversight process that's established by the chairman of the Joint Chiefs of Staff. Lieutenant General Douglas Robb was sworn in recently as the first DHA director. His deputy is Alan Middleton. Mr. Middleton had been serving as the key transition director for the stand-up of the DHA. Dave Bowen remains the CIO, although he adds responsibility as director of the Health IT Directorate. And the acting director of the Business Support Directorate is Colonel Darrell Landreau. Colonel Landreau recently arrived from the Office of the Air Force Surgeon General. Here's a top-level overview of the Defense Health Clinical Systems. This is a new organization having stood up in April and replaces what was DHIMS, the Defense Health Information Management System. Their mission is to sustain the current EHR suite of IT applications and systems. The EHR Core PMO, Program Management Office, develops and manages information management tools that capture and share health data across DoD. Also, the data sharing PMO oversees efforts to work with the VA to ensure medical data for service members transitioning to the VA is shared. And finally, the Deployment and Readiness Systems PMO develops and sustains mission-critical IT capabilities that transmit health information for wounded warriors as they transit from the battlefield to the care facility. And that office is led by Charles Updegrove.
Now moving on to the Defense Health Services Systems, or DHSS, which is the largest health IT acquisition shop for DHA. Now this office provides DHA with clinical support, medical logistics, and resource management to support applications that maintain warfighter readiness and optimize the delivery of health care to DoD service members. Now the Medical Logistics Division, as its name suggests, ensures that medical commodities get to the battlefield or to the required DoD facility. Now, this division provides special needs management systems and electronic healthcare reporting. The Resources Division contains the centralized data store for DHA, and their other roles include managing products that support medical coding collections, personnel management, and other resource management tools. Now, the Enterprise Infrastructure Office is kind of new, kind of not. It was previously known as the MHS Cyber Infrastructure Services Office, and it manages the overarching IT infrastructure and support services for all of DHA's centrally managed information systems. Now, the EI office manages the network layer and all of the computing infrastructure for the support services for DHA. The EI division offers DHA users email, mobile device support, collaborative software, and shared storage of user contact information.
Now, DHA obligates about $10 to $12 billion a year on contracts. Spent about $27 million last year through GSA Schedule 70. DCITMS 3 was a contract vehicle heavily leveraged by MHS. It's expiring this fiscal year, and there are no plans to recompete that contract. So the agencies have said that they're going to be utilizing various other acquisition methods and vehicles such as GSA and CIO SP3. Here's a quick look at the DHA top IT-specific contractors. This is by no means an all-inclusive list. The overall rundown is dominated by healthcare companies, as you can imagine. Plan Systems International, which you see there, is a prime on the previously mentioned DCITMS 3. Also, when the integrated electronic health record effort is stood up and becomes a reality, Systems Made Simple will provide SI and engineering support. Among its drivers, an integrated electronic health record, or IEHR, is the #1 priority for the agency. The department wants to develop a seamless electronic exchange of healthcare information in a secure and private format between DoD and VA. There have been roadblocks, but the ultimate goal is a unified EHR system that will ensure all DoD and VA health facilities have both active duty and veterans health information available throughout their lifetime. VA's virtual lifetime electronic record is very similar, although that's more geared towards medical record sharing with private providers. Now, one of the driving forces for the establishment of DHA was to drive down cost. The military is now spending just as much on health benefits as they do on salaries. So General Robb and his team will be looking at industry for ways to streamline processes and reduce complex operations, all while achieving actual cost reductions. Finally, ensuring that DHA's systems are secure, especially the future EHR, is a top priority for Dave Bowen and his CIO team.
So as Lloyd briefly mentioned on his driver slide, the goal of the IEHR program is to create a comprehensive electronic health record in concert with the VA. Of course, in 2009, as we all remember, President Obama directed DoD and VA to build a seamless way for a service member to no longer have to physically walk paperwork from a duty station to a local VA health center. Now, what was the EHR Way Ahead program was slated to go into effect by 2017 with a price tag of about $4 billion. But unfortunately, in February, both the VA and the DoD went their separate ways, with DoD focusing on a replacement for its legacy healthcare IT system, citing technology challenges and skyrocketing costs. Now, despite setbacks this year, the vision for an integrated solution still remains alive, but the higher priority for the time being will be replacing Alta, which is DoD's legacy EHR system. Although the Pentagon hasn't entirely discarded the idea of adopting VA's EHR system, they are openly looking to industry for options for COTS solutions. Now, in fact, this week, DoD is hosting demonstrations for possible replacements. Christopher Miller is overseeing management of this effort as the PEO for Healthcare Management System Modernization.
TMIP-J extends the functions of DHA's information systems here to the deployed environment, including the battlefield. The program is designed to enable tactical access to the electronic health record, as well as medical logistics and patient tracking capabilities. In keeping with the overall theme of common operating picture, another way to describe this program is as a medical command and control, if you will, that will allow health professionals to capture and aggregate data and conduct trends analysis. The program and the system are designed to adapt also to whatever specific theater requirements are needed. The President requested about $100 million this year. That's a slight uptick over last year. Spending will go towards systems supporting new medical equipment and customer assistance modules that are going to be sent to the theater. We're also going to see monies go towards licensing, testing, and program management of their existing portfolio, such as the tactical version of Alta. Now, speaking of Alta, you have information on Alta in the planner, as well as other aspects of DHA, but in the interest of time, we're not going to cover it.